In the United States, healthcare can wipe out your savings. In Europe, we were taught that it is a free right. But this is an illusion. The truth is that European healthcare is a blanket that's too short. Every nation is forced to sacrifice something. Our money and taxes, our time waiting, or people themselves. There are no exceptions. In this investigation, we will use 7 key nations to reveal this trade-off. We will see why some of the wealthiest systems are the most inefficient and how others survive only at the expense of their neighbours. But be warned, our aim is not to criticise and complain. In fact, we will also show and praise systems of the highest quality. Our goal is to give you a map, a key to understanding why your country made certain choices and what consequences they have for your life. Understanding the mechanism is the first step to preparing for the future and acting with awareness, because only those who know the truth can be truly free to choose. Welcome to Amazing Europe. Let's start with the cliché. Germany is the engine of Europe, a model of efficiency. Even in healthcare, the numbers seem to shout success. Berlin devotes over 12% of its GDP to the system, the highest figure in the European Union, and boasts a hospital bed density that is almost double the EU average. Have a problem? There's a bed ready for you. And yet, this is where things go wrong. If you spend more than everyone else and have more hospitals than everyone else, you should have the longest living population, right? But no, German life expectancy lags in 15th place in Europe, surpassed by countries that spend far less, such as Spain and Italy. Why has this engine stalled? The answer is not only in Germans' lifestyle, but in a very serious structural imbalance. Germany built a hospital-centric system, but forgot the foundations. General practitioners. OECD data show a rate of GPs below the European average. The filter is missing. The professional who knows you, follows you, and prevents hospital admissions is missing. Without this filter, the patient goes straight to a specialist or to a clinic. Result? Costs explode and the system becomes overloaded. But an even more worrying fact emerges from the reports: failure in prevention, especially among the less affluent. While in other Western European countries, prevention is fairly widespread across social groups, in Germany, the poor get sick much more and much earlier. With no capillary network of GPS providing health education, those with fewer resources skip screenings, eat worse, and smoke more. Moreover, Germans spend fewer healthy years than their European neighbours, spending the last 15 to 20 years in expensive hospitals that often still operate by fax. Until recently, and in part still today, hospitals and doctors communicated that way, as the 2024 report reveals. The consequences are redundancies, repeated tests due to missing medical records, scattered data, and administrative waste. In short, the German paradox is this: a gigantic system but slow, huge expenses treating seriously ill patients, but poor investment in prevention. Now let's move east, where the story changes radically. Estonia didn't digitize for fashion. It did so out of pure survival. Emerging from the USSR with empty coffers, it couldn't afford Germany's luxury. With healthcare spending of just €2,145 per capita, against an EU average of nearly €4,000, they had to do a lot with little, and they bet everything on the code. While Berlin relied on faxes, Tallinn built a national health record on the blockchain. Today, 100% of prescriptions are digital. It doesn't matter whether you're rich or poor, whether you live in the city or the countryside. The 2025 report confirms the digital divide is non-existent. Data travel fast, cutting bureaucracy and errors. The result? Estonia has very low rates of avoidable hospitalization. The system catches problems before they become costly admissions. Sounds like the future, right? Hold on. Here too, the blanket is short and it's being pulled in 3 directions. First, the human factor. Estonian technology is a sophisticated crutch for a fragile body. Doctors and nurses are in short supply, and 43% of them are over 55. The digital system weathers the strain, but it can't treat anyone if there isn't a doctor behind the screen. Second, the hidden cost. The state is efficient because it shifts part of the burden onto Estonians. Out-of-pocket spending is 22%, one of the highest in Europe. If you need medication or dental care, be prepared to pay. Almost half of pharmaceutical spending comes directly out of household pockets. Third, culture. You can have the best health app in the world, but you can't program people's habits. Estonia's alcohol consumption is above average, and youth obesity is on the rise. The Estonian lesson is bittersweet. Digital efficiency is the only way to avoid collapse, but it isn't enough to make a population healthy when money for medicines is scarce and lifestyle education is lacking. So far, we've talked about money and technology, but healthcare, in the end, is made of hands that operate and eyes that watch the monitors. And here, we enter the darkest part of the OECD report, the staffing crisis, a crisis that is reshaping European geopolitics. Imagine a company that invests hundreds of thousands of euros to train an engineer, grooms them, specializes them, and the day after graduation gives them away to the competition for free. This is Romanian healthcare. Romania is the epicenter of the European medical brain drain. Let's look at the data. Romanian universities churn out doctors and nurses at a high rate. The quality of training is good, but if we look at OECD charts on the density of active healthcare staff in the country, Romania consistently lands near the bottom. The reason is purely economic, rational. A nurse in Bucharest in 2010 earned a fraction of what they would have taken in Paris or Rome. By 2024, the gap has narrowed, but not enough. Working conditions, facilities, and career prospects push people to leave. They are not traitors. They are professionals acting according to the laws of the single market. But the consequences for those who remain are devastating. The 2024 report shows an alarming figure: preventable mortality in Romania. We are talking about people who die from causes that, with timely, standard medical intervention, would have been avoidable. Romania has some of the highest rates in Europe. Why? Because the people are missing. What analysts call healthcare deserts are created. Entire rural areas where there is not a doctor within kilometres. The hospital may exist, perhaps refurbished with European funds, but it is an empty shell. This is the price Europe's periphery pays to keep the centre healthy. And it is here that our investigation turns toward one of the nations that, more than most, welcomes Romanian doctors. If we look at the macro statistics, we are facing absolute excellence. Life expectancy ranks among the highest in Europe. Healthcare spending is massive, second only to Germany. And financial protection is nearly complete. Out-of-pocket spending by citizens is under 10%, one of the lowest in the world. If you fall seriously ill in Paris, you are well protected, excellent care, and your finances intact. It is no coincidence that the World Health Organization named the French health system the best in the world several times in the early 2000s. But according to the latest reports, this system is beginning to show cracks. In fact, once you leave the capital, the facade of perfection collapses. France has created so-called medical deserts. The OECD 2024 report certifies a shocking figure for such a wealthy nation. Between 2013 and 2023, the density of general practitioners fell by 5%. The result is a deeply unequal system. Formal access is guaranteed to everyone, but real equity is not. An educated person lives on average 8 years longer than someone without a diploma. 8 years, one of the highest gaps in Western Europe. How does this giant with feet of clay avoid falling? Simple. France has become a predator in the European labour market. To fill the holes left by French doctors who retire or refuse to work in rural areas, the system imports staff on a massive scale. That flow of talent we saw fleeing Romania? It ends up here. France plugs its internal hemorrhage with personnel from peripheral countries. It is a zero-sum game, unsustainable in the long run. The government is scrambling to respond. They have increased medical school places by 20%, and are expanding the powers of pharmacists and nurses to cover the gaps, somewhat like Estonia. Make no mistake, this is still a system that shines, but its light does not reach all French people. Let's step outside the EU to examine what, for decades, has been the holy grail of public healthcare, the National Health Service. For the British, the NHS is not a service, it is a secular religion. The idea is noble, the perfect antithesis of the American model. Free care for everyone, always. No credit card, no bill. But the economy has no feelings, and the law of supply and demand is brutal. If the price of a good is zero, demand tends toward infinity. When you have infinite demand and a finite state budget, you have to ration. And if you do not ration with money, you ration with time. The 2024 report slams this calculation into your face. Today, in England alone, there are 7.5 million people on waiting lists for hospital treatment. That is more than 1 in 10 citizens. In 2012, the figure was 3 times lower. For a life-changing operation, such as a hip or knee replacement, average waits exceed a year. Ambulances queue outside emergency departments because there are no beds to offload patients into. Waiting is no longer a mere bureaucratic nuisance. It has become a clinical risk factor. How did the system get to this point? It is the perfect storm. On one hand, the NHS has historically had fewer beds and fewer doctors than its European peers. It is an engine that has always run at the limit, held together by adhesive tape and goodwill. On the other hand, the United Kingdom has become the sick man of Europe. Record obesity rates producing a surge of costly, complex chronic illnesses that are crushing an already fragile system. The result? While people elsewhere are living longer, UK life expectancy stopped rising long before COVID. Is there a silver lining? Absolutely. No British citizen will ever go bankrupt because of cancer. Financial protection is complete and administrative costs are very low. But the English lesson is a warning for us all. A pure universal system guarantees the right to care, yet if it is underfunded, it may no longer guarantee care itself. Here is the exact opposite of the English model. If the NHS pays with time, Switzerland pays with money. Lots of money. There is no big brother state running hospitals here. The state only acts as referee. The players are dozens of private insurance companies competing. The rule? Every resident must buy a basic insurance policy. The result, looking at OECD 2024 data, is every patient's dream. Switzerland has eliminated the concept of waiting lists. Want to see a specialist? You see one immediately. The facilities are 5-star hotels packed with technology. Life expectancy tops 83 years and cancer survival rates are among the highest in the world. It seems like paradise. But what is the catch? The catch is that the bill is not invisibly paid through general taxation. It arrives in the mailbox every month, and it is hefty. Switzerland is the European country that spends the most on health, over €5,600 per capita, compared with an EU average of €3,500. For an average family, insurance premiums are a noticeably large budget item, between 300 and 600 francs per person per month. And there is a detail that graphs often hide, the deductible. To lower the monthly premium, many citizens pay the first costs out of pocket, up to 2,500 francs. That said, Switzerland does not abandon its citizens. In fact, 1/3 of the population receives state subsidies to pay for insurance, although these aids often do not cover the out-of-pocket costs of consultations or dental care. However, the whole truth must be told. With a median gross salary of 7,000 francs for the vast majority of Swiss people, this is not an injustice, but simply the market price for first-class healthcare. Before we reveal the last 2 countries that represent a statistical anomaly and explore some key solutions to the European healthcare problem, if you found this video informative, we kindly ask you to support our project with a like, subscribe to the channel, and click the bell so you don't miss our new videos. We are really curious to know about your experience with your country's healthcare system. Write it in the comments. So far, we have followed the logic of money and efficiency. But now, OECD data throw us a challenge that seems impossible. Let's take Italy and Spain. 2 economies marked by high debt, structural unemployment, and healthcare spending per capita that is 20% lower than the European average. On paper, they should be a disaster. Yet, look at the longevity rankings. In 2024, Italy is first in Europe at 84.1 years, closely followed by Spain. They live longer than Germans, who spend twice as much. They live longer than the English. Is this a calculation error? No, it is what I call the X factor. But before revealing it, we must dismantle a lie. These systems are not as efficient as they look. Italy and Spain live by a double truth. The public system works excellently for the big scares: heart attacks, cancers, transplants. Here, mortality is very low. If your life is at risk, the system saves you, free of charge and well. But for everything else, daily care, rehabilitation, diagnostics, the machine is slow, sometimes stuck. Here, the first differences between the two Latin cousins emerge. In Spain, citizens open their wallets mainly to cover the gaps in the system. Private spending reaches 21%, concentrated primarily on dental care, which is almost non-existent in the public sector. In Italy, instead, citizens pay 23% of total spending out of pocket to escape the system. They pay a private specialist to skip the waiting list. It is an implicit tax on impatience and fear, but the most dramatic difference is geographic. Spain is decentralized, true, but it manages to maintain relatively even coverage. Italy, on the other hand, is split in two. An authoritative 2025 report reveals a devastating political fact. Southern Italy has stopped being treated at home. In 2023, 1 patient in 5 in Calabria had to pack their bags to receive treatment elsewhere. This creates a financial flow of almost €3 billion that every year moves from the south to hospitals in the north. While Spain manages inequalities, Italy has created a system where your postal code decides the quality of your survival. And yet, despite waiting lists and geographic fractures, people live long lives. Why? Here is the X factor. The OECD struggles to put it on a chart, but it is there. It is a combination of lifestyle and shadow welfare. First, Italians and Spaniards drink better and eat better. Lower rates of heavy alcoholism and adult obesity, compared for example to Eastern Europe, act as a zero-cost form of preventive medicine. Second, family. In Sweden or Germany, elder care is institutionalized and expensive. In Italy and Spain, this pillar rests on the shoulders of families. When an elderly person is discharged, they very often do not end up alone in an institution. They return home, cared for by children, grandchildren, or a network of carers paid from family savings. This social cushion is worth billions. It covers the shortcomings of a system that, especially in Italy, has a dramatically low number of nurses, almost half compared to Germany. The Latin miracle is not the child of bureaucratic efficiency. It is the offspring of a cultural and social capital that, so far, has made up for the lack of funds. But beware, families are having fewer children and young people are emigrating. That social capital is being depleted, and when it runs out, how will those longevity charts change? The European healthcare system is genuinely high quality, but there is no perfect or free healthcare system. Rather, there exists a short blanket. If you pull it one way, you uncover the other. Every European nation has made a strategic choice, often unspoken, about what to sacrifice in order to excel in another area, be it money, time, or human capital. What do the OECD 2024 reports tell us in chorus? They tell us that, whether we like it or not, the era of passive healthcare is over. The one in which you paid taxes and the state took care of everything free and immediately is an illusion we can no longer afford. In fact, in several European countries, it already no longer exists. But the reports do not only highlight the problem, they also show the threefold solution, which is what our governments will inevitably try to implement sooner or later. The future demands task shifting. We will have to get used to nurses and pharmacists taking over from doctors in the routine management of diabetes, vaccinations, and chronic conditions. It requires dehospitalization. Hospitals will treat only acute cases, while technology will handle remote monitoring. And finally, there is the most important thing of all, the 40% factor. What are we talking about? That if the public system focuses, rightly, on major emergencies, the rest will increasingly fall on us. We will have to choose whether to pay with money, by taking out insurance or saving for old age, or better yet, to pay with our lifestyle. Because the cruelest fact of all is that 40% of the costs clogging hospitals are linked to preventable diseases. The true life insurance today is not only the policy we sign at the bank or the guarantee provided by the state, it is the one we build for ourselves every day by deciding whether to be a passive cost for the system or an active asset for our longevity. There is no perfect system. There is only how prepared we are to face what is coming. For example, you can watch this video in which we reveal the 10 European countries with the highest obesity rates. You will discover some truly interesting facts. That's all for this video. See you next time.